So let's assume that you have lost some of your teeth in the upper jaw, let's say a premolar or molar, and some time has passed. Let's say a couple of years, and you decide you need to replace those missing teeth in this area with dental implants. So you come here to doctor's office, you do a CBCT scan, and he sees that there is not enough bone in the vertical dimension, and he proposes you a sinus lift. So we're going to talk about what sinus lift is, how is it done, and do you need one? So a sinus lift surgery is a type of bone augmentation surgery actually. If you want to know more about bone augmentation surgeries, you can check in my other videos, you can find it there. So let's continue this video back. A sinus surgery is a type of surgery where you raise the level of the missing bone in the upper jaw by using the sinus space. So how is it done? You open up a window through the mouth after you remove the patient's gums. You cut through the bone, and then you elevate the sinus mucosa carefully with different types of instruments, and you fill it with different types of tissue. You can fill it with, like in any bone augmentation techniques, material. You can add it xenograft, which is animal origin, alloplastic materials, which are mineralized origin, allografts from human cadavers, or your own bone, if you autograft, or your own bone that has been harvested from different part of your body, of your jaw, or with growth factors that has been used from your peripheral blood. So after we did the sinus surgery, we raised the vertical volume of the bone by several millimeters, just enough to make a safe space to place your dental implant in the future. Sometimes it is possible to do sinus surgery and implant placement at the same time if there is enough bone present, or sometimes there are different solutions for sinus surgery. These are called short and extra short implants, in which we place implants that are 4 to 5 millimeters in length and do the same job as normal regular implants after they have been also integrated 5 or 6 months later. So you can completely avoid a sinus lift surgery if it's possible by using short and extra short implants. The other way you can avoid doing sinus surgery is by placing implants in an angulated position, which is really common when we talk about the classical all-on-4 technique by Paulo Malo, when he uses an angulated position of placing the distal implants in the upper jaw, which then avoids doing any necessary sinus lift surgery. But this sometimes is also not possible, and it has its own problems because you raise the cantilever of the prosthodontical superstructure, which can then break if too much force is applied. So patient selection is really important to that the patient is a candidate for possible angulation of the implants to avoid sinus surgery, and that the cantilever of the remaining prosthodontical prosthesis is not too long, so that it will break on chewing forces. After sinus surgery is done, post-operative care, you should listen to your doctor. It's completely standard with any surgery. You should avoid hot beverages, liquid smoking, do your antibiotic therapy, and you should lie down steady. There is no lifting of heavy objects, and sometimes blood from this side on the left or on the left side of the left nose cheek or the right, depending on which side you did the sinus surgery, can sometimes drop. You can have droplets of blood sometimes, because this is completely normal, because we entered the sinus wall, and sometimes some bleeding is possible, but this is almost minor and no need to have any panic about it. So I really hope you like this video, and I gave you some information on what sinus lift is and how is it done. And if you have any questions, you can comment down below. Click the like and subscribe button for my future content, and check out my other videos as well. See you soon. Bye.